Well, hello, everyone. We're going to give folks just a minute or two to get into the meeting room. I see that we're still getting folks added, so just give us another minute or so and we'll get started. Okay, it seems to have slowed down now. I'm sure we'll get some more additions as we go through, get into the program. But thank you all very much for joining us today. We're very pleased to have with us this afternoon our good friend Pat Alcock from the Office of Training, Education and Development, or Oted. All of you probably know Pat well, but Pat is the director of ORA's office of ORA's Oted. Oted's primary role is to analyze, design, develop, implement, and evaluate adult education training, development, and certification programs for FDA ORA employees, as well as our state, local, tribal, and territorial regulatory partners. Pat has been with FDA since receiving her BA from Lycoming College in 1989 and has multi-district and multi-center experience at FDA. She served as an investigator in 2 ORA districts for 7 years, a compliance officer in CEDAR's Office of Compliance for 3 years, and has been in a management role with FDA since 1999. She has received many FDA level awards for her contribution to public health protection, and we are very pleased to welcome Pat today to give us an update on Oted. Pat, do you want to go ahead and begin?
Absolutely. Can you hear me? I just want to make sure my speaker's working. This is around the bewitching time that my Wi-Fi decides it needs to take a nap. So hopefully it's usually 2 o'clock. So maybe we're good with the Wi-Fi gurus. So thank you very much, Steve, for that introduction and for including me in today. I think it's important as the director of Oted to continue to communicate with all of our stakeholders and state partners, and this is one of those methods that you and I started a couple of years ago, I guess now, to be able to at least address questions that we think are ongoing and either through the chat box or in some other open forum be able to address any specific concerns. So Amy, next slide, please. There were essentially 5 or 6 topics that I thought I'd at least give you a highlight and update you on as to what's been going on in either FDA or in the Office of Regulatory Affairs and specifically in Oted. The question that I think many of you are asking, and we heard it a little bit at the AFTO conference several weeks ago, is what's the status of the upcoming fiscal year 22 training schedule? Essentially right now where we are is we've finalized the training schedule based on what the analysis that we did, and I'll talk through what that looks like in a little bit. Finalized it. We're now reaching out to our instructors and subject matter experts within the agency and contractors to begin the scheduling of those courses, at least from the standpoint of, hey, we're going to have X amount, 4 of these, 3 of these, whatever. And essentially for you all, what that means is we committed several years ago to try to push back the schedule so that it aligned a little bit better with what the states needed for the purposes of upcoming contracts. And so that was our commitment. I want to say John Stoll came up with that idea. He has since retired, but he came up with that idea, and we've been trying to move it closer to the June, July opportunity. So we have cleared the schedule from Oted's perspective, and then this is where we collaborate and coordinate with OP. OP will be sending out shortly. I can't commit when because it's their resources, but the pre-registration notebook is then what really opens the door for you all to see what the schedule is for fiscal year 22. And then you ask for as many seats as you need. They work through the allocation numbers for the courses for fiscal year 22 and then let you know what that looks like. And then we continue to plan the actual delivery and scheduling of courses for fiscal year 22. Clearly, COVID has continued to have an impact on what we're doing in our schedule. As much as I would love to be able to go back to pre-COVID days, I think that right now, considering where the agency is with our personnel, we've not fully returned to full force back to office. The scheduling, the travel, there's still areas, maybe much less than what it was clearly, last year at this time. But we are indeed right now planning for virtual instructor-led modalities. We did convert, depending on whether I look at it fiscal year or total, we've converted all of the courses that we did in fiscal year 21, both in the human and animal food realm, as well as the medical products and tobacco, who are another set of ORA folks that we train. We converted all of those courses with the help of either contractors, with the help of AFTO, with the help of NEHA and others, to be able to convert to do this virtual delivery. So I think right now we have to continue with that kind of beat of the drum while we get a few other things under our belts with respect to what courses need to be done face-to-face. We've made a couple of decisions on some of those, but most of them we're kind of continuing in the, we are continuing in the virtual environment at this point. I think that kind of follow through and follow up with COVID and getting everybody readily available, and the impact of COVID to people being able to travel, not so much because they don't want to get on a plane, but because maybe their kids are still in that 50-50 blended school. So now there's childcare, elder care issues that prevent our subject matter experts, who we need to do the training, from being able to travel. So at this point right now, the schedule is indeed still planned for virtual instructor-led training. There might be a handful that we do, and I am indeed planning on those being within the Rockville, Maryland facility. I don't think that many of them are going to be in the human and animal food arena. The only one that might be is, which you will also see on the registration document, I think for the first time, is any ESAF training. We haven't offered ESAF training in many years. The system is actually being replaced, and we thought it was best to do that in person and not spend the time transitioning the content because we know something else is replacing it. So that might be the only one that we're doing in Rockville at this point, but that's where we are right now with the schedule. So you should be seeing something from OP on seeking your individual state training needs for the courses we're offering. As we typically do in these cases, OP and Oted host a call with the states, both on the East Coast and West Coast time, to walk folks through the pre-registration notebook. So that's kind of our standard practice these days, to be able to get a sense of what your training needs are based on what's on the schedule. So that's really update number one, and the highlights of what we're doing. I'll talk next about our independent course delivery, or train the trainer program. This has been a collaboration with AFTO and California Department of Public Health and NASDA and New York State Department of Ag for several years now. It has been kind of on the same, doing this in, not on the back burner, it's kind of in that warming tray where we've been working on trying to do this at the same time that we were delivering courses, and then abruptly had to update content for virtual instructor-led. But I am pleased to report that we are planning on standing this up by the end of this calendar year. Since at least January, we have met pretty much monthly with AFTO in California and New York and NASDA to walk through what we learned from the pilot courses that we did, which were the FD 152 foods, I always get the name wrong, food processing technology, as well as FD 190, which was the GMP and evidence development course. And so we learned a lot through a couple of pilots. This is a program where the state brings in their folks. We help train them through a program designed to teach. They attend the course, so they know the course content. They then come through a course-specific instructor. So we teach them how to teach the course. So that's the train the trainer part. And then they offer the course to their staff, and we come in and watch and observe and give feedback daily. And then the certificates would be issued. I think right now we're saying the certificates would be issued by the state, but Oted would batch them so that we can have a sense of completion of those certificates and the number of people. And then we would accept those certificates for prerequisites further down the line through our training programs. We're really excited. We spent fiscal year 20 kind of behind the scenes working with a contractor to develop process flow diagrams and help us with procedures. And this is going to require our organization, my organization, to repurpose staff so that they are readily available to manage the program, because I did not want this to be a kind of put it over the transom and not really understand how it goes. And I'm really pleased with the work that we've done thus far. I think we're close to tightening up and finalizing the procedures and process. And now we need to work on some communication. This is really an opportunity. We have 2 states that participated in the pilot. And right now, this is an opportunity for states to either work with each other to figure out how you might be able to use this new tool. We think this is really a helpful tool to be able to help you stand up and do your own trainings, given that I understand, there continues to be an access and availability issue. It certainly does allow for collaboration in your, I'm going to say tri-state. As a Jersey girl, I'm used to tri-state, but in the local areas of your neighboring states, it's a great idea for you to be able to see if you can share resources that way. There is no funding associated with this program. There certainly is funding in other avenues within OP that should be able to help defray the cost. But right now, that's where we are. And I said the 2 courses were 152 and 190. We continue to work with AFTO and NASDA and California, New York. We've got a couple of other courses we're looking into based on their feedback that we're going to have to design some train the trainer programs for, so that we can actually teach people how to teach the course. And then at some point through the process, Oted does want to be able to jump in and kind of just see how folks are doing. The commitment is you teach the course the way FDA teaches it. So you stick to the content and the course content materials that are there. So there is an audit function that we still have to work through, but it will be similar to, the observation and evaluation forms that we've developed. We've streamlined timelines and timeframes from when the pilot was original, and that's really good news for how effective the pilot was. And I think that this is really, we're eager to be able to launch this. It's just, I admit it's taken us longer time, but unfortunately, that's just been the nature of what we've been doing. But we're close. I mean, we are this close. I just have to reassign some staff, train some staff, and start looking towards what other courses we can do. So that's really a new and exciting development that we've done. The third item I wanted to just touch on briefly was we are, looking at, we did virtual instructor-led training for half of 20 because of COVID. We've done virtual instructor-led for all of 21. And 22, we plan on doing it at this point for the entire year, unless some things drastically change. But then you have to worry about getting into locations and finding hotels for staff. And, once the hotels are open for business full time, everybody who wants to get married and have conferences and that kind of thing, you're competing with those resources. So I think at this point, it is definitely virtual. But I do recognize that the future is blended. What do I mean by that? I mean this combination of asynchronous online modules where you get introduction to information to help you understand the concept, some virtual instructor led where we use some of the technology that we have to be able to help folks connect the dots to what they learned asynchronous, talk a little bit more about it and engage in the various, not just chat rooms, but breakout rooms and that kind of thing. And then really, yes, there is a need for face-to-face training, but we need to really refocus what that looks like from the standpoint of where are we going to spend our dollars the best? What do I mean by that? Where are we going to do performance where maybe you can't really perform an inspection in the confines of my dining room. But if we were to go into a classroom and do some mock exercises where you actually perform and talk to people and do those kinds of things, I think, I really recognize that's the future. It's the future of where all training industries are going. The federal government has never quite always, at the beginning of that curve. But I think it's going to take some time because it's going to take time to redesign. One of the biggest lessons that I think we learned from this opportunity with COVID was we pivoted quickly because we knew that folks needed to be trained to continue to onboard and hire the staff that you all had, that we had. But I think we tried to do a one-to-one relationship on our training, meaning that if it was 8 hours in a classroom, we split it in 4 hours each day. And what we're learning is that these are different skill sets in the virtual environment. There's several courses that are out there that talk about how to be a good presenter, how to be, what kind of virtual instructor-led training needs have to be. And the reality is you need more slides. You need less words on the slide. You need more engaging tools every 2 to 3 minutes. You need to ask the right questions instead of, and hopefully we can keep our cameras on to be able to read that body language. But there's a slight redesign that needs to occur with all of our courses. And we're not able to do all of that and develop and produce what we need to produce in 22. So I think there's going to be a little bit more time where we have to make some of those decisions over time, which I know everybody's worried about. It seems to be the enemy these days. But make more decisions about how do we acclimate some online, what could be virtual, where does it really have to be classroom? And I'll leave this thought. I've been attending a lot of other training industry kind of meetings, and it's clear to me that this is not an environment that people are comfortable with, right? Unless you're like in school now, in academia or college, you didn't learn with a camera. You learned in a classroom. You learned by talking to other people. You learned all these things. And so these new tools, increase that learning curve for us, increases the uncomfortableness of doing it. But I got to tell you, when I look at the cost savings, associated with it, not that that's the main driver, but it has to be looked at as we continue to rebalance our own, budgets and stuff. The technology is there. And we're also working closely with other partners to be able to figure out how can we do either mock exercises or, we're not quite ready for AI. Although AI, to me, every time I hear it, I think virtual reality, but the reality is there's much more before virtual reality that can help us augment the training. So the future is blended, but blended being a myriad of training opportunities and events, not just the classroom. But I also know that it's uncomfortable for many because you're used to doing it in the classroom and training that way. And it's a hard habit to break. But I do think that this is really one of the things that COVID brought to us as an opportunity to embrace. And now we just have to continue to plan and pivot while still delivering the courses to you all, because, ideally, if I were my own organization and not the federal government, I'd probably shut us down for 6 months and revamp everything, but we don't have that luxury. So definitely virtual is here to stay. I think it's just going to we have to figure out what the right percentages are. 2 more topics, and then I'll see what questions are coming in. Steve, the priority setting for Oted, our largest part of our work, our main focus, is the delivery of training courses, right? Not only to the human and animal food, state, local, tribal, territory partners, but to FDA as well. We also have additional stuff that Oted does that many of you may or may not know, and that is on the medical product side, medical products and tobacco. We also train our ORA staff on any ORA IT systems, such as ORADs. We also train our staff on a management leadership development program that has some excellent development programs for our employees who are either considering management or have entered first line and now want to be a manager of managers. So we have a lot on our plate. The catalog is huge. And part of what I need to take into consideration as we do this is every time I add a course in a different modality, that's more content that needs to be updated. And we've been so quick, especially in the human and animal food, of wanting to get you the right information on FSMA that, we've had, and we only have so many subject matter experts. So the difficulty has been trying to update the content, whether it's because of regulation or changes in inspection procedures, and some of that happened with FSMA and, even now, post-COVID. And trying to make sure that we are consistent, whether we're teaching it in an asynchronous model, if we're teaching it in a virtual model, where it might be a little bit different versus the classroom. So I need y'all to know that even though my catalog, let's say for food, is 40 courses, if it's 40 courses, but it's 2 different modalities, that's 80, right? And then you add on the medical products and all of the other stuff, and it's a lot to update when the denominator of SMEs is still only so many. So that's one of our biggest hurdles. It's not really on my list here, but it's part of why looking at the priorities becomes important. So when we look at how does Oted decide what courses you're going to offer each year, we reach out to OP and we talk about what are the contract commitments that are coming up for down the pike. What did we do last year? So that we can kind of project, especially with an eye towards FSMA, what do we think the needs are? And the data that we get from OP helps us to understand what the asks are, at least on the contract side. It doesn't address the program standards. It's not perfect, but it helps us to at least go, okay, this gives us some wiggle room. The other thing we do is we look at on our ORA side, what is the actual inspection work plan for the next year? And this also tied in nicely with not only with your contracts that happen in July, June, July, August, it helps with the inspection planning and work planning that occurs around that same time for the future year. So we look at the half inspection work plan and we pulled data from our own learning management system and said how many people are trained in this particular type of inspection so that we can try to figure out where some of the gaps are. And then we develop a course schedule based on that. I have in the next couple of weeks, they're going to be sitting down with our program directors to let them know what the schedule is so that they too can see, well, no, we don't need so much of this. We might want something of that. And similar to what we do with, it's not exactly the same as the pre-registration notebook because that helps OP to really understand the depth and breadth of what you all need. But it is a data source that we do for setting our priorities. Training our staff, training you all, state, local, tribal, territory, is our bread and butter. We also do voluntary certification programs for our staff, which is another one of our daily job stuff. And then we look at internally, what else are we doing that impacts Oted and other things. And so those other priorities become things like the independent course delivery train the trainer program, where we're trying to set up a new model or approach for how we do business. And then we have to figure out how to set that up in a quality system. Some other things that we've been doing, just typical federal government, you know, making sure we have the records management and filed in the right requirements per the NARA and the federal requirements for records. It may also include things like making sure we continue to train our personnel so they can continue to be the experts that they are in their background. So there's a little bit more to the priorities than just the training, but I suspect most of you will want to know more about the training schedule, and that's really the intent of that. The last topic that I'll mention is a prerequisite update. I don't know if it was this in this forum or in the previous AFTO conference last year. There were a couple of questions about the requirement for FD 254, which is the preventive controls course, and being a prerequisite for the acidified foods course. And we went back and forth internal discussions about this, and I'm pleased to announce that you should have seen an updated course announcement for the acidified foods. We have removed the 254 requirement because it really isn't required under the inspections of acidified foods under the definition of acidified foods and the appropriate regulations there. This has caused us a little bit of, we have to go back a little bit and look at the content across the acidified foods course. But I want to make one other point. So that's the good news. The good news is it took us a little, the bad news is it took us a little bit to do it because we were busy doing virtual instructor training transitioning. But we did indeed remove the 254 course as a prerequisite. What I think this also signifies, Steve, and I don't know, you know, this may not be the appropriate time to talk about it, but we're finding those niches where manufactured food, and this is considered a manufactured food course from our perspective, and retail food have different needs, and this fills the gap. The problem is when I don't want, well, I'm going to say the problem. The problem is when FSMA came in and the FSMA, you know, definitions of qualified facility and limited scope and full scope and the needs of manufactured versus retail, it left this gap that had many wanting this course for your own, what I believe to be state reasons. And I don't know if the right term is mom and pop, cottage farm, retail, and yet the interpretation was being in different ways. And so this whole intention and use of a course is kind of where we find ourselves in some of these situations. So I'm not sure how to fix it yet, but we recognize that by putting the 254 requirement, one, it wasn't tied to the acidified food definitions, and two, it limited on the retail side. But I do think we're trying to figure out how else can we bridge those gaps where retail and manufactured food need it, but maybe at slightly different levels. So it's fixed a problem and created 2 or 3 more, which is, you know, kind of how things go. But I do think that, you know, I wanted to at least share that with you because that's happened within the last month or so. And with that, Amy, I'm up for questions and, you know, whatever's in the chat box, Steve.
So our first question, and Pat, this might be something we punt over to OP, but the question really was, if they were put on a wait list at FY21, does that state get and didn't end up ever getting a slot for something like conducting seafood inspections? In FY22, do they get a higher priority? And If you don't want to take that, that's a Matt Avis question, really. So
it's definitely a Matt Avis question, and it's really a prime question to ask when we do the annual walk through the pre-registration notebook, because not only can I not say the word algorithm without really thinking it through, I don't really understand the calculations they do in the background for the allocation. So I think that's really better suited to them.
Yep, absolutely. The next question that I have on my list anyway, Pat, first, we want to thank you for definitely taking a look at the acidified prerequisites. I know that was a common theme that you had heard for a little while. So great work on that. We appreciate it. And I know that everyone on the call wants to thank you for your quick conversion to virtual training as we went through the COVID times, and your willingness to do that quickly and make it available broadly. I know we've all thought highly of that. But I think the next question that I know that I just got a text message. Sorry, I'm getting questions all over on here. Someone just texted me the question was, we talked a little bit about manufactured foods, but anything you could tell them about what's happening in the retail food world? As you know, many of these programs have both programs, and they're curious about that program also.
The retail food program, at least for what we've currently planned, if I look at what we did in 21, right? And I'm going to get these numbers backwards, but I think 70, yeah, I'm going to get them backwards. A large percentage, I think it's 90% or so, thereabouts, plus or minus 4%, of the work that is offered by Oted in training delivery is actually done by AFTO or NEHA in the retail space. 78% of the work that is done by AFTO, NEHA, I can't remember if there's another partner, and I apologize, I should have had these statistics ahead of me, is actually done for the entire state cooperative programs. So a lot of the work that we're currently doing in the space right now is indeed being done by you all, so that it frees up our staff to work a little bit more on, I'm getting some feedback, so I want to lower my, gives our staff time to work more on some of the retail initiatives under New Era. And the training impact to that. Janet Williams is the new director of the Division of Programmatic Training. She replaces John Stoll. She's sitting in on some of those internal OSCP conversations that we're having, as well as retail conversations, to be able to bridge that gap. But I don't know that I can answer the question fully. The retail courses that we're going to offer that AFTO or NEHA are going to be shown in that particular schedule. It's just a matter of who's delivering it. You guys are doing that on our behalf by way of grant or grant. So we look at all of our courses from the perspective of how do we update and those kinds of things, but I don't have an answer specifically any more than that at this point. If somebody wants to, ping me an email and just kind of ask a little bit more about what you're looking for, that's helpful. We're aware and involved in the New Era, revamping of retail. We're trying to look at some of the courses. I know Janet has several ideas, as has OSCP with Lori Farmer, on how we need to reevaluate some things, because the retail space is certainly, especially with COVID, have become even more important for us to be able to address some gaps. It's just about timing and trying to prioritize everything with only so many experts and only so many staff.
Sorry, that's me, Pat. Sorry.
All right.
I hit mute on myself. We do appreciate the number of retail courses, and I know the staffs across the country have been very happy that those were able to be modified quickly. The next question we had is, can independent course delivery at the state level be offered face-to-face, or does it need to be virtual? It's a great question.
Absolutely, it's a great question. This is another program that we started with the intention of being face-to-face, because that's how FDA was teaching the courses. And for all intents and purposes, all of the pilots were done face-to-face, with one exception where COVID just began and we had to delay doing the training, where the state offered to do the class with all of the right personnel protective things, but we couldn't quite get our staff up to the state to be able to do the observation. The pain point, for lack of a better word, is that the materials for the train the trainer are still developed on an instructor-led, so they would need to be transitioned to virtual. And then we have to reevaluate, all right, now that we're doing virtual for over a year, how does that change the delivery, right? And so again, that's a gap where I feel like I'm on a hamster wheel, because we've made all these changes for virtual, but we haven't been able to go back and update instructor manuals, train the trainer manuals. So it's still a work in progress, because COVID kind of took us by surprise. So I'll have to go back to the actual instructions. I think that the biggest issue is really the material is developed as if you're teaching in a class. So it shows you how to set up the classroom. For example, in 190, right, there's the climb the pallets and take apart the adulterated flour and show us that you know how to do a field exam and find the rat and the mouse-like pellets, right? So that's all set up in the instructor manual as actually being able to be done in a classroom. How do we do that? We've had to modify because we were sending people their own materials to their houses or other locations. So I don't know that the materials have caught up with it. It's still one of the after effects of COVID.
Absolutely. Once again, a reminder, if anyone has questions, please put those in the Q&A window. We have another question, Pat, and I think this is a question that I've heard more than a few times, and I suspect you have too. Do the course instructors have access to the LMS systems? Many times instructors ask for copies of certificates. Also, the course registration form asks for completion dates when the information is already in the LMS. Is there a better way to streamline this process? Anything, and I know that's probably a comment as much as a question. I don't know if you have any background you can add there, or that's one to take back and maybe discuss in a future discussion.
Sure. Access to my learning management system known as Pathlore has been probably one of the most frequent questions, more so than the 202 prerequisite. The issue has always been about resources of Oted and previously DHRD to be able to access accounts, teach you how to use Pathlore. And frankly, Pathlore is under sum total as a learning management system and is probably 20 something years old. It is clunky. It is an old learning management system that is no longer being supported by the vendor. And we actually just recently awarded a new contract for a new learning management system that can at least allow folks to be able to put in training that they do outside of what is ever, FDA or ORA training. Access by instructors. I got to be careful because we are talking about a learning management system that is being used to document training occurred for the purposes of people's development and the work they do thereafter. So access security, when it's sitting on an FDA system, as is Pathlore, I have to worry about IT security issues, everything from who might be hacked that gets into the FDA secret sauce for Coca-Cola, trade secret stuff, to PPI, to all of that kind of stuff. So there's security reasons for it. There's up until the learning management system we're using now and will continue to use for the next year. There is definitely still security issues and frankly, staffing issues on my part. I can't, part of what we used to get was, hey, Pat, can you give us a copy of all of our certificates because my employee lost his certificate and we're getting ready to get audited and we need certificates. I don't have the staff to be able to do that. So clearly trying to be able to go into the learning management system and being able to download it yourself or have the employees download their, I always forget this word, transcripts to be able to help explain what your staff has done for purposes of audits or tracking is readily there now. There is on the front page of Pathlore instructions on how to download your entire transcript. Doesn't exactly answer the question that's being asked. And certainly we're trying to be able to streamline the processes. We have to reevaluate some business processes as we transition to a new learning management system. We have to transition all of the data from Pathlore into the new system. There's some, I already said business processes, but there's also, we have to we have to verify that, you are who you say you are. there might be two Pat Alcocks, you know, in a given state who might be two different people, or it might be Pat.Alcock instead of Patricia.Alcock. So there's all of these things that we're trying to make clear about unique identifiers, not using social security numbers. So there's a lot of work ahead of us before we're going to be ready to go with the new learning management system. But the good news is, and I should have led with that, is that we have acquired a new learning management system. We literally just did the kickoff meeting with the vendor, but we're going to be doing some parallel work for the next year and a half before I can say we're flipping the switch on the new one and turning off the old one. Are you on mute, or did I lose my internet again?
No, I muted myself again. We've got a couple people around me today. So my question was, Pat, I think what you just told us was the LMS is likely to be something that people start seeing out there in late 2023, early 2024 calendar years. Is that pretty close?
You know, we haven't really even begun to talk to the folks that figure out when we can go live, because we've got so much other work we have to do ahead of time. But yeah, I'm aiming for, we might be doing dual, but you're not going to see it per se. You know, in 22 is all about implementation. So it's not going to happen in 22. I think definitely in 23, maybe mid to late 23, we should see some improvements. And the whole reason why we went to a new learning management system was because we didn't want to get stuck with being told, hey, we're no longer using this, see ya, FDA. And then the impact that would have to our state partners. And we did take into consideration when we did the market research, the needs you all have, the wanting access, the multiple ways of having ways to control and verify identity without somebody sitting at the computer actually having to do it, because that's the resource burn.
Absolutely. And I don't know if you can share this, but one of our partners says, we're looking for a new LMS. What did you choose? We're just curious. Are you allowed to release that yet, Pat?
I haven't even told the rest of FDA. But if somebody wants to email me, we can certainly look into that. Yep. We had, because the FDA has because the federal government has the FedRAMP approval process requirement, we actually worked with a contractor to help us figure out, you know, of the million learning management, I made that up, out of the thousands of learning management systems that are out there, how many were FedRAMP approved? And then we did some market research from there. So I do have several that we were looking into. So, and they're ones that are pretty much out there, right? Blackboard, Cornerstone, some total was actually up there. So, and probably one other one, but I'm forgetting it.
Yeah, I tried to think. Desire to Learn. Did you? I don't know if that one. That's a common university.
That one doesn't sound familiar. Because again, that FedRAMP. If you didn't figure out all the paperwork to get FedRAMP approved, we couldn't even. We weren't going to have the luxury of time to sponsor you and buy your product. So.
That makes total sense.
At least that's how I understood it. So.
No, that's good. We have a question, and this is pretty specific, Pat. But the question is: we are not able to access the food series classes, food 2 through 5 on ComplianceWire due to the retirement of Adobe Flash Player. When can we expect to gain access to these courses again?
My understanding is we spent the latter part of 20 and beginning part of 21 fixing all of that with Adobe. Now ComplianceWire, I don't know what food 2 through 5 are. ComplianceWire fixed most of them. And remove the Adobe. We then also tested many of them. The only ones that were up for where we kind of put to bed for a little while were the micro ones, which we did for a couple of other reasons, more than just Adobe Flash. But it's my understanding they should be up and running. So the last call I heard where I asked for an update was that the micro ones, not only were we looking at it to remove Flash, but then we were also saying, well, these are so old, we need to figure out what we're going to do with them, right? Yep. So I'm not sure if the food 2 through 5, but if you want to email me, whoever's asking, Mary, if you want to email me the specifics, I can certainly look into it, because between our CRADA with ComplianceWire and the work my staff did between ComplianceWire and our own work, that was supposed to have been addressed. So if it's not, we need to know about it. So I'll write it down as well, but an email will help jog the memory.
Absolutely. And of course, Mary, Amy, if you can add into the Q&A window, Pat's email address for Mary, and I think one other person we asked to email Pat, that would be great. So thank you once again. Let's see, if you have questions, please go ahead and put those in the Q&A box.
Actually, Amy, my email is on the last page for contact information if you want
perfect.
to forward that.
There we go. We'll go to the next slide. There you go. So there's Pat's email address for everyone's. So for those that had
there's also
questions.
The general email Oted box that we monitor. So if you want to send it to me and or the Oted box, we've gotten questions in the Oted email box as well that we can make sure we can send to the right folks to address.
So we have one more question, Pat. Is FDA going to continue creating equivalent courses in PathFloor or the new LMS for the old Compliance Wire courses? I think that's what's happening with the Compliance Wire courses question.
Great question. I don't know that I have an easy answer. Certainly, we've had a variety of projects that have been ongoing, both with the Integrated Food Safety National Curriculum and the development of the Gen Eds, as well as some of the Compliance Wire courses. After you guys have been doing a lot of work for us to be able to assess, Gen Ed versus Compliance Wire. Does it replace, augment, help us to figure that out without just making a casual decision that might actually impact people's ability to do that. The Compliance Wire CRADA folks, the UL Engineering, we are in our 5th or 6th version of the CRADA. And so certainly we're trying to look at new and novel ways to do things and really assess whether or not content has been helpful and or need to be replaced. The micro courses are a really good example of that, because it took us a couple of years to do it because everybody kept going, well, we have it for different reasons. And then we hire in spurts. So it was like, well, you got to hurry up and, train everybody. So leave it alone, but improve the curriculum later. And well, later never came. Right. So I think that, we're trying to do our due diligence at the same time that, now all of a sudden my staff had to pivot and do instructor-led training courses, pivot to virtual instructor-led training. So it's a good question. And I think between the help that we're getting from our grantees on some of the decisions, we are going to have to make some decisions about, do we continue, in Compliance Wire, we have and or our own learning management system. Some of that data is indeed transferred back and forth right now. So I have to figure out how we're going to do that with the new learning management system. But my bigger concern, which I think is where you're coming from, and certainly what I've heard at the Alliance meetings is, are we duplicating effort, Pat? Do I have somebody doing Compliance Wire and then they're doing a Gen Ed and it's the same stinking information? It's a waste of resources. So we hear you, but it all ends up about how do we prioritize all the work, right? Because and it's been made clear to me, so I'm going to make sure everybody understands we are never going to get the resources we truly need to do all of the things we have to. And that becomes an issue of prioritization. And unfortunately, deliver the courses, get the people the work they need so they can get out there and protect public health is the driving force. And I can't argue with that. Every so often I threaten Steve that I'm going to shut down Oted for a week or month, but then I know the kind of phone calls I'm going to get. So we don't do it, I'm joking. Okay?
No.
But it is, it is kind of this consistent need to be able to reprioritize.
Yeah, I mean, imagine, I think many of you, almost all the folks on the call have been through a transition and inspection system. You've got to operate the old system while you're building the new system, and at some point duplicate and shut them off. And that's really hard to do all together. It's same process.
I think once we get all the info for the new learning management system and, not remember, because I didn't mention this, I got to get, even my learning management system folks have to come up to speed with this new system. So they have to very quickly become super users. I think once we get a handle on the learning management system and the way we can do it, and we specifically looked at things that we could, it had to be compatible with Lectora or Captivate or, you know what I mean? So we were thinking more than just the immediate need to be able to transition to many of the other bells and whistles that we wanted. I think once we get our arms around the data and being able to do that, we can start having those conversations that say, okay, here's the skin or the script of what this compliance wire thing, says. Do we want to put it in the learning management system? Is it covered somewhere else? And I think we're going to be making those decisions, but not in the next year or so.
So we got a follow-up question, and I think you kind of answered it, but just in case, will compliance wire be around for a few more years, or is it going away, or is the answer we're not sure?
At this point, my CRADA is around for another 2 or 3 more years, most definitely. And so I don't think that it's not going away soon. I mean, at some point we have to look at it, because we're also using, on the medical product side, I'm using materials from the CRADA that we didn't develop, right? So that's helpful to me. And there are some even in the human and animal food area that might be helpful for folks because of the, the work that we're doing with UL. So I'm the director of the place and it ain't going away that I know of. So unless UL decides, but I have an agreement through at least 23, 24, 25, something like that.
Yeah. And if I remember right, you're just probably not doing a lot of modernization of courses within that, the compliance wire UL agreement.
Yeah. I mean, not at this point. We are looking at maybe some other alternative ways of doing business, right? Because, those were developed in the early 2000s, right? When online training was novel. Well, we're 20 something years of experience now. What else can we do? And in some respects, the CRADA itself allows us to, we gave them the content, they put it in their learning management system, we get use of it, share it with you all, and they got to sell it. Well, in some instances, because we haven't updated it and we're trying to get better about updating content for them as well, they've not been able to sell it because people looked at it and went, this doesn't even mention FSMA. What are you doing? So, we are working with some of those same subject matter experts to update the content. So, sure. It's another example of, I mentioned Pathlore and I mentioned different modalities, but then when you add compliance wire and you add the gen eds, you know what I mean? Again, the catalog just continues to grow from the standpoint of updating. And we've got to figure out a better way to harness the SMEs to help update the content. And that's really, I'd like that to be one of my longer term strategic priorities if we can get through a couple of the current short-term ones. So.
Yep. Absolutely. No, that's the giant challenge to maintain a whole catalog of training in a current format when everything moves, and particularly when it's a lot science-based and science changes relatively quickly in the current era. Yep. So I think, Pat, we've answered all of the questions. Is there anything else you'd like to share with the folks that you thought of while we were sitting here, or other things that you'd like everyone to be thinking about in the next a year or so that's coming up that you haven't had an opportunity to mention to them?
I think that one of the things that we'd really like to be able to have a handle on is, and it was mentioned at the AFTO conference, is really trying to get a handle on, my management and I continue to hear training is a problem, but it's not really further defined as to what that is. And my conversations with many, both external and internal, has been that it appears to be access and availability. And when you have a limited capacity, which at the end of the day, you all understand because you too have your own limited capacities. When you have limited SMEs, limited dates, conflicting times when people can get together, longer training programs now because we've gone virtual, it's difficult for everybody. And I think that one of the things we're trying to figure out, and we're going to be doing a focus group, a very small focus group, to test the waters on some other modalities, but recognizing what does that mean? Because, and Glenda Barfel, my boss, mentioned it at the AFTO conference about, working towards some sort of asynchronous modules for access and availability. We're going to walk through in the focus group what that proposal looks like, get feedback as to, is this the right problem? Are we answering the right problem? So you're going to see some of that because we're trying to do this in a short period of time. We're going to do one focus group and then kind of analyze the results and see where we go from there. I don't have an entire proposal together because I didn't want to dot all the T's, cross all the T's, dot all the I's, and develop a proposal and use my staff's resources to do that if it isn't really the answer to the question. So we are looking to do a focus group and then kind of reconvene and look at the answers and work internally with FDA, because, you know, FDA has experts, you know, the centers have experts that help do our training as well. And everybody's agreeing there's a need and we need to partner, but there also is a need that everybody's got day jobs that are in addition to training. So I think you're going to, you know, I don't know how wide we're going to cast the net for the focus groups, because I think we want to hit a lot of the associations. So obviously AFTO would be asked for a representative, but I'm not going to be able to open it to every state and every focus group, because I think we're really just trying to understand what is the issue, and kind of work from there. And then we'll kind of reconvene and have some conversations about, well, if we put it on asynchronous, and this is what I started to talk about earlier, if I have 152, it's a bad example, but I'm going to use it anyway. 152 being taught by Ohio State, at Ohio, and now we also do it virtually, and then I put it online. Now that's 3 courses to maintain at some point. And then if I said, if we also put it in train the trainer, now that's 4 courses, right? That's 4-fold increase in work. So we have to make some decisions at some point about, well, if you're going to do it asynchronous, then we take away something. Whether the something is no longer classroom, if you're doing ICD, train the trainer, then, you know, your seat's got to go to somebody else, because we're still doing training that way, unless we, you know, change the model, because all of that model changing requires new procedures for me, reassigning employees, retraining employees, and then maintaining it. So I think that, you know, we want to be able to modernize, and I've heard Oted isn't modernized. Okay. How do we do that in a world that needs the training tomorrow for something you're doing next week, and still update and use the technology? And that's the struggle. And so I think that asynchronous training, you know, we're going to have some conversations. It means different things to different people. So we're going to have to dive in a little bit more and talk a bit more about that within the next probably less than 60 days. We're still working on the timeframes, but it might be August, September. That's pretty much the only thing I know right now off the top of my head, and the 4 or 5 things that I presented here. And, you know, I appreciate your support and want to keep the lines of communication open with the folks here on the phone and by the states, because we can't do it without you. It gets a little unnerving at times for me as the head of the organization to be told there's problems. But, you know, I do realize that we're not perfect and we need to be able to address things. I think I'm seeking your assistance in understanding that there's a lot on our plate, and add one more thing that somebody thinks fixes something else, and now you've got, you know, 6 other problems. So.
Pat, we did get one more question in, and if the question is Oted open to states creating equivalent courses of their own, or would Oted be able to approve the use of a potential equivalent course? And I know this is a concept that you hear often, equivalency. Where's Oted at on equivalency?
Our efforts for equivalency have not occurred.
Okay.
And they can't occur because there's too much involved in it. That didn't come out right, so let me apologize for that.
Oh.
When AFTO and NASDA in California, AFTO and NASDA in New York wrote a letter to the commissioner back in 2017, I think equivalency was one of the conversations. And when we started the state training work group, there were discussions about how to prioritize the suggestions in that 2017 letter. And the one that was thought to be the most helpful was the ICD train the trainer program. The equivalency is probably something, honestly, is greater than Oted. And I think that part of what the conversations I'm having internally is somehow by procedure, process, or in the union language, past practice, right? Somebody decided that to go for states to do this work, they had to go to FDA training. But it's not really clearly in the standard that way. So I think we have to go back to the beginning parts of the standard and make some reevaluations of what does that look like. I think that's the better way to kind of relieve some of the pressure on the pressure valve, but you're going to need a group to help make that decision, and who gets to be involved in that, and what are the procedures, and I think it's bigger than just equivalent to 202, 203, 204, 340, right? I think it's really got to go to what are the intention of the standard and moving the line for mutual alliance even further by being able to do that. I don't know how to solve that one. And given what we've got on our plate right now, I haven't stood up the train the trainer program, which I think is going to be helpful, but I don't know how many states are really going to be able to take it on themselves. I'm being asked to consider asynchronous training to help those states who can't get there, which is another change in the model. And then if I'm asked to do equivalency, I've run out of staff. I've run out of staff to do the work 3 projects ago, right? So it's a how do we even think about it? It's a resource. If we start a work group with, cross sections of states and CFP, PFP, AVDO, NEHA, NASDA, how long is that going to take? How do we make sure we're on the right path? So I think the equivalency is probably another approach to consider. I just can't take it on with what we're doing right now. And I think it's better handled in the standard. And it's something I've floated to Barbara already as this is how the pressure cooker started when we were 10 states in doing contracts, but the model at Oted hasn't grown. It grew, but it hasn't grown commensurate with the bolus of states who now want this and program standards and mutual alliance. So we've got to look at the whole picture, not just the training aspect.
Yep. Well, with that, I think that is the last question, Pat. And I know that as we get to the top of the hour, we're getting some folks dropping off, and that was our last question. Anything else you'd like to add before we wrap it up for today? And as always, we appreciate your participation and the participation of all of our states across the country.
No, I think we're good. I want this to continue to be helpful. So I'm looking forward to, hearing from the evaluations and folks if it was helpful. And, how could we improve this approach? And I'm, trying to just help figure out how to help communicate, because I realize in the absence of that communication, people fill in the gaps, and we don't want that. So,
absolutely.
And I appreciate our continued relationship. So thank you.
Absolutely. Thanks a lot, Pat, and have a wonderful day. Thank you again to all of our participants. And we look forward to talking with Pat again in the future. I don't know exactly when, but as we get a new list of questions, we'll do another chat with Pat. Thank you all very much. We'll take care.
Everybody.
Yep. Bye-bye.